Hello, everybody. This video will be going over the general information for the molecule of histamine, its function and metabolism, the disease states when there's too much or too little of it, as well as the diagnosis and treatments of the aforementioned disease states. When most people think of histamine, the first thing that might come to mind are allergies like sneezing and runny noses, which is definitely a primary function of the molecule. Um, I have put up some images of common antihistamines, which block the reception of histamine to the H1 and H2 receptors, namely Benadryl, Claritin, and Zyrtec, which are the commercial names for these types of medicines. Histamine is a type of biogenic amine derived from the amino acid histidine. Structurally, it is a simple compound, a five-membered imidazole ring attached to an ethylamine chain. It has a chemical formula of C5H9N3 with a molar mass of 111.15 grams per mole. Its bonds are all covalent, as well as its asymmetrical structure, making it a polar molecule. A physical property of histamine is that it is a white crystalline or powder solid at room temperature and has a melting point of about 84 degrees Celsius. And a chemical property of histamine is that it is highly soluble in water and it is considered to be hygroscopic, which means it will absorb water vapors from the air surrounding it. Histamine is a neurotransmitter that plays several important roles in the body. One we have briefly mentioned is the main reason for the symptoms of allergies, such as getting that runny nose and watery eyes, but it also acts as a vasodilator when released at a site of injury or infection, allowing the blood vessels at the site of infection to expand and become more permeable, as well as acting as a stimulator for the secretion of gastric acid in the stomach, which is needed to break down food. Cells that produce histamine include mast cells, basophils, and enterochromaffin-like cells. Mast cells are found in connective tissues throughout the body, especially near the skin, lungs, and digestive tract, while basophils are a type of white blood cell that circulates in the blood. Both mast cells and basophils are able to release histamine during allergic or immune responses. Enterochromaffin-like cells, or ECL cells, are located in the lining of the stomach, and they release histamine to help stimulate acid secretion. Histamine is produced from the amino acid histidine through a process called decarboxylation. The enzyme that catalyzes this reaction is called histidine decarboxylase. When a carboxyl group is removed from histidine through a decomposition reaction, it releases histamine and carbon dioxide. The normal range of plasma histamine is considered to be between zero point 0.3 and 1.0 nanograms per milliliter. Anything above 1.0 can be considered too much histamine, which can lead to histamine intolerance, allergic reactions, or more severe conditions like anaphylaxis. The symptoms will depend on which histamine receptors are activated and specifically to where they are located in the body. For the H1 receptors, these are primarily going to affect your allergy and inflammation symptoms, as they are found in the smooth muscles such as airways, blood vessels, and the skin. Some common symptoms include itchy skin, vasodilation, hypotension, tachycardia, flushing, and pain. The H2 receptors are found in the stomach lining and will affect stomach and digestion issues, such as excess histamine causing excess stomach acid, which can lead to acid reflux, heartburn, or gastric ulcers, perhaps even nausea or bloating. For the H3 receptors, these are found in the central nervous system, and they are involved in the blood brain barrier function to regulate the release of neurotransmitters like dopamine, norepinephrine, and acetylcholine. This can cause symptoms such as disrupted sleep, anxiety or hyperactivity, headaches, migraines, or just a general imbalance of other neurotransmitters. And finally, we have the H4 receptors, which is present in bone marrow and hematopoietic cells, and can affect inflammatory disorders and autoimmune diseases. This can cause things like chronic inflammation, pain or itchiness, and things like rheumatoid arthritis or inflammatory bowel disease. For anaphylaxis, this will be an extreme case of a massive release of histamine. This will occur during a life threatening allergic reaction, which will affect multiple H receptors. So, this can cause things like swelling, hives, trouble breathing, nausea, stomach cramps, widespread nervous and immune system responses, as well as a drop in blood pressure, rapid heart rate, and unconsciousness. Histopenia refers to the abnormally low levels of histamine in the body. When it falls to around zero point 0.2 to zero point 0.3 nanograms per milliliter in the blood plasma, it is technically considered too low. But it is less commonly discussed than histamine excess because it is a lot rarer. But it can still affect both the nervous system and immune response, and has been studied in connection with mental health and certain metabolic issues. Some general physical symptoms of histopenia can include things like fatigue and low energy, digestive issues, low libido, as well as an allergy resistance. And some mental health symptoms linked to histopenia include things like obsessive behavior, paranoia, auditory hallucinations, and depression, and a general irritability. The disease states of histamine are usually diagnosed through simple blood or urine analysis tests, sometimes perhaps a allergy skin test. However, fully checking on a patient's histamine level is usually not done outside of situations such as anaphylaxis. That being said, there are different levels of histamine that we can put in our bodies by the foods we consume. So, a patient with too high of a level of histamine might be suggested to go on a specific diet. The most common medication used to fight excess histamine are the antihistamines I went over at the beginning of the video. Things like Zyrtec, Claritin, Benadryl are all examples. These medicines work by blocking the H receptors in the body to reduce the effectiveness of histamine, stopping the aforementioned symptoms from arising. These usually take around 30 minutes to 2 hours to take full effect, some taking a little longer to up to 4 hours. Common antihistamines are usually ingested via the oral route, though there are different forms of the medication, including nasal sprays, eye drops, skin creams, and injections, as well as for anaphylaxis, that has the epinephrine autoinjector, which is the medication that goes into the side of your thigh. For histopenia, medicines for this condition haven't been extensively researched, but certain medications such as opioids or narcotics can be used to potentially increase histamine levels back up in the body.